Welcome to the Mom is Fit YouTube channel. In this video, I'm going to be breaking down what I'm doing at 1 year postpartum to help support my pelvic floor. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula and mom of 4, and I am about 13 months postpartum. And I want to talk about the things that I've been doing to help keep my pelvic floor feeling symptom-free and pretty good here at a year postpartum. Your pelvic floor is a sling of musculature that sits at the bottom of your pelvis and provides a ton of different functions for you. It helps with sphincter control, so keeping poo and pee in. It helps to support your pelvic organs. It has a big role in stabilization as a part of your core canister. It helps with lymphatic drainage and flow through the pelvis. In addition, there is a sexual function with a big role during childbirth. The pelvic floor is definitely a really big buzzword, and so you might be wondering, how can I support my pelvic floor? Not just during pregnancy and not just in the early postpartum, which we have a ton of videos all about that, but how do we support it long term? Because I don't know about you, but I don't want to be peeing myself or dealing with issues from prolapse when I'm like 60 and 70 years old. And so I'm going to be doing things now to help support my old lady body as well. One of the key concepts to understand is that your pelvic floor attaches to the pelvic bones. And your pelvic bones have the ability to change position, which means it can change the tension of your pelvic floor. For me, I tend to favor a little bit more weight in my right leg, so this right pelvic half tends to sit back and my left pelvic half shifts more forward. And this is a really common postural tendency that a lot of us tend to have. With this postural tendency, the right anterior portion of my pelvic floor is really overactive and working really hard, while the left posterior portion is a little bit tighter. And so with my pelvic floor strategies, I'm thinking about how can I offload my right leg so that I can put more weight into my left leg, in addition to improve how well my left hip shifts. So let's break down some mobility exercises that I'm doing to help support my pelvic floor, in addition to some tweaks to my strengthening exercises to help support my pelvic floor health. The first exercise that I like to incorporate into my routine is going to be back expansion breathing. I'm literally just rounding in my back and breathing in this space. And you can do this from a standing position, from an all fours position. There's so many different positions that you can get into, but I'm really thinking about rounding in my back and breathing here. I'm going to start by thinking breathe into the back side of my body, almost as if I'm trying to breathe into my lower back or to the back half of my pelvic floor. And then when I exhale, I'm going to think lift in the front half of my pelvic floor and pull belly to spine. So big inhale into the back, exhale belly to spine. In addition to more weight in my right leg, I also tend to favor a little bit more extension in my spine, especially if I've been baby wearing or holding my baby a lot. And so finding these back expanded positions just brings me into the opposite position to help release tension in the back half of my pelvic floor and my lower back to support my pelvic floor function. The next exercises that I'm going to be incorporating are going to be focusing on offloading the right half of my pelvic floor. So I like to target more groin and inner thigh stretches on the right side to help offload it. So you can do with this half lunge position here. In this half lunge position, I'm taking lots of weight in my right big toe. I'm putting my hand onto my right knee to keep it pressing out. And then I'm almost thinking like I'm trying to pull my belly away from that thigh to feel a really big stretch here in my groin. And then I can rock in and out here. I can also find that same groin release in an all fours position. So I'm going to shift my weight to my left leg to feel that groin stretch in the right side. And I could also find a little bit more of an arch in my back to help intensify the stretch in that right groin. When we find more extension in the spine, it tends to target more of the anterior pelvic floor. And then I can also do it from a standing position. And so in this position, my leg is in a straight position, which is going to kind of target my inner thigh and groin a little bit differently. So in the lateral hip shift, I have weight in both of my big toes. So I'm going to think, put my 2 hands onto my hip bones. As I shift to the left, that right hip is going to be oriented towards that left knee. And so I'm going to feel more of a stretch in the right groin and inner thigh. And then same thing here, I could find a little bit of an arch in my back, maybe target a little bit more to the right side to intensify the stretch as well. But key movement things to think about is weight is in both big toes, hips are oriented towards the left, and I'm finding a little bit of an arch to target more of that right groin. Those 3 exercises help to offload the right half of my pelvic floor because sometimes when I'm doing my single leg exercise, I feel a little bit more impingement or pinching in the right hip because that pelvic floor half is really active. In addition, I'm kind of stuck in an internally rotated position on the right side. So doing those 3 exercises really helps to offload it so I don't feel that pinching in my right hip, and it helps to support my pelvic floor. Now, when it comes to the left half of my pelvic floor, I'm focusing more on hip shifts to help release tension in that posterior pelvic floor. And similar to the right side, I do have some all fours and standing variations. With the all fours hip shift, I'm going to take that yoga block and place it underneath my left knee, and then I'm going to shift my weight over towards the left side. So it's really similar to the all fours hip shift that I did before for the right leg, but now I'm elevated so it's targeting more of that left hip. From here, I'm going to think round in my back because a more rounded position helps to target more of the posterior pelvic floor, if you recall from the back expansion exercise. So here I've shifted to my left. I'm feeling a big stretch in my left glute, kind of hip pocket area. And then I'm going to push through my hands to round in my back to intensify it a little bit more. And with both this variation and the other all fours hip shift, I can also move through some pelvic tilts to just increase pelvic mobility. For the standing variation, I'm going to place my left foot onto that yoga block, and I'll start with both hands in front. I'm going to open up and then hinge forward so that I'm feeling a lot of stretch here in this left hip pocket again. I'm thinking shift my weight back and diagonal into the left hip, not straight back, but I have like 80 to 90% in that leg. Then I'm going to think lots of weight in that left big toe, rotate that left knee in, and then belly is rotating towards the thigh. So similar to the other ones, if I have my 2 hip points, that right hip is more towards the left leg. In both of those movement variations, I'm feeling that big stretch here in this back hip pocket. So those are the mobility exercises that I incorporate pretty much daily to help release uneven tension within my pelvic floor to help support my overall pelvic floor function. But let's talk about how I'm tweaking my strengthening exercises, because when it comes to our pelvic floor, it's not just can I stretch and release my pelvic floor, we also need to incorporate the strengthening aspect as well. With my strengthening exercises, I'm going to add a little bit of a tweak to my single leg movement. My right hip tends to favor more internal hip rotation, while my left hip tends to favor more external hip rotation. So on the right side, when I'm targeting the right leg, I'm going to hold the weight in the right hand. And for my stagger stance or RDLs, I'm going to inhale to lower down and then exhale to come up. But you can see that my hips stay more forward. So the hip points are more oriented to the front. When it comes to the left side, I'm going to keep the weight in that right hand. And then when I lower down, you can see that my hip points are rotating towards that left leg to find more internal hip rotation. The difference between this offsetted exercise is my right leg glute and quad are going to be working a little bit more in this neutral position. While on my left leg, this is going to target more of my inner thigh and my hamstring because I'm finding a more internally rotated position. And I can do this with all of my single leg exercises. So all of my single leg movements, I hold the weight in the right hand on both sides. And this is just going to change how my hips are going to be twisting and moving during the movement to help support my pelvic balance. Another thing that I do for my upper body to help support my pelvic floor is sometimes I add a little bit of variation to how I am pulling or rowing movement. The right side upper body, I focus a little bit more on pull down motions to target more of the trap musculature, while on the left side, I focus a little bit more on rowing motions to strengthen the lat musculature. So this little bit of offsetting between the right versus the left side can help to strengthen and to support the normal balance that a lot of us have. So my main targets for the right side is to help strengthen the quad and the glute in a more neutral or externally rotated position. While on the left side, my target is to find more internal hip rotation to target more of the inner thigh and hamstring. I can also progress that to the upper body where I focus more on right side pull downs and left side rows. All of these little tweaks and offsetting of our mobility exercises and with our strengthening exercises can help to increase and optimize our pelvic floor. Our pelvic floor is more than a single sheet of muscle. There's a lot of different muscles within there, and different hip positions and postural tendencies can change the tension and balance within our pelvic floor. So we don't want to do just one movement to stretch our entire pelvic floor or one movement to strengthen our entire pelvic floor. We want to think about how can I support my pelvic floor and its different quadrants, knowing that I have normal asymmetry and I may need to do things a little bit differently on both sides. I hope this video was helpful so you can understand what I've been doing to help support my pelvic floor at a year postpartum. And it does feel a little bit complex, but once you understand that we all have normal asymmetry, it makes it a lot easier to apply these concepts to your daily workouts and your daily movement routine. But if you want more support from us because you don't want to have to figure this out all by yourself, check out our online prenatal and postpartum fitness programs because we incorporate tons of pelvic floor exercises and ones that you may not even know are pelvic floor exercises in every single workout in our prenatal program, our postpartum program. And if you are beyond 6 to 9 months postpartum and you're like, I don't need a rehab program, we do have our Beyond Postpartum Strength program that I'm currently doing that's going to help to support your strength and pelvic floor as you progress through motherhood. You can check out all of our fitness programs on our website at mamastayfit.com and use code YouTube10 to get 10% off any of our online offerings. I hope this video was helpful for you to understand what you can do to help optimize your pelvic floor to support you during pregnancy, birth, postpartum, and beyond.